We're here with one of my favorite representatives, Mike Hawker, who is really the good guy to go to for things like math, because you are a one-time CPA.
I was once a CPA. I was once an investment banker.
So you understand the hard numbers.
I certainly like to think so. And when I ran for office 14 years ago for the first time, that was the one thing I really wanted to bring to the process, was someone who had a very serious financial background and could really focus on the financial future of the state. We look back 14 years ago, Dorene, we're in a very similar economic circumstance today. 14 years ago, we had just come off those single-digit oil prices. We had burnt through $5.5 billion of our $7 billion in savings. And at the cash burn rate for the state, we had about 3 years savings left. That's
Sounds
right
very
where we are
familiar.
today.
Very familiar. Well, let's look at Medicaid expansion, because this is something that's new and unique. Some people are saying it's going to save us a lot of money. Other people are saying maybe not so much, and maybe actually might end up costing us money. The governor decided this on his own. He asked you guys for your opinion. You did not come up with a decision that he liked, so he moved forward. What do we do now with this?
I think you've identified one of the 3 or 4 most significant issues in front of government today, and that is this expansion of our Medicaid population. And we talk about expansion, what it really means is, for the first time ever, we the state will be making Medicaid, or government-sponsored health insurance, available to folks 19 to 64 years old who have a low income, less than 138% of the poverty level. That cohort of folks previously had no ability to turn to government coverage like children or pregnant women could. Now, there's really 2 sides of the argument. If the governor and his people are right, we are able to add this cohort to the state, and we will save so much money on other government services they do not consume that it will actually pay for itself and generate a couple of $100 million in general fund savings. Now, there are legitimate criticisms of the governor's plan. If the governor is wrong, we've really got 3 big concerns. The legislature has 3 big concerns. One, that our computer systems aren't able to handle this increased population. On the out end of it, that the federal government may change its commitment to fund 90% of this expanded population.
Wouldn't be the first time they did something and then did a quickie and left.
And it's a very, very significant issue in this coming national election. And likewise, then in the middle of the governor's plan is that the arguments are there will be greater enrollments, that there will not be the savings that he expects to achieve.
Other states have experienced that.
Some states have experienced that. Other states have experienced actually a pretty fair outcome. So the key to me, and this is what I'm working on currently, is I truly believe that the governor, while he didn't violate the technical law in unilaterally expanding Medicaid, I do believe that he bruised the spirit of the law in making such a significant policy call without working its way through the legislative process. You
guys had hired consultants, as did he, and weren't you waiting for the return on their advice?
Well, when he made the decision to unilaterally expand Medicaid, the legislature had not yet even, in fact, to this date, we have not finalized our selection of a consultant. The administration itself had just completed their procurement of a consultant to help them design their implementation. Now, I believe there really is a solution to this whole situation, and it's not too late to do it, although we should have done it in a regular session before the governor was forced into taking this unilateral approach. We can still put sidebars around this expanded program. Sidebars, kind of like a freeway. We're going to have an on-ramp, we're going to have an exit ramp, and we're going to have some traffic cops along the way. You know, and the on-ramp would be a statutory provision that says, if the federal government does not certify our Medicaid management computer systems, and there's a federal certification process, if we don't have that, the Medicaid expansion does not occur. Likewise at the back end, the exit ramp. If the federal government does not live up to its financing commitments, our expansion component stops. You know, it automatically, without further legislative action. And in the middle, I'd suggest for the first 5 years, which is what we use in fiscal planning when we pass bills, the fiscal notes.
Right.
that if the general fund savings are not realized, that are expected in that fiscal note, the Medicaid expansion program goes away. We can put these automatic exit ramps into statute that address the concerns that have legitimately been raised with the governor's proposal. I've spoken about this with the governor. He's receptive to the idea of putting these sidebars on, and I think it becomes a win-win for everyone. If the governor is right, and Medicaid expansion is the greatest thing in providing access to affordable health care in the state of Alaska since who knows what, great. It's a wonderful thing for us. We save money, we get increased health care. Good job, governor. But if, on the other hand, those folks who say it's not achievable, it can't be done, and we know what those challenges will be, then the program will automatically terminate at the end of the following legislative session. I think we've got a way to protect everyone here.
Sounds like those sunset clauses might be a really good idea.
I really think so, and they're not at all unlike the sunset clauses we put on other state programs.
Well, we got to take a commercial break. Stick with us. We'll be right back.